Hello, and welcome to this edition of Berkshire Matters. I'm Bob Dean. I'm your host for today's show. And today we're going to be talking about harm reduction. And our guest today is Sara DeJesus with Healthy Steps in Pittsfield. Welcome, Sara.
Hi, thank you for having me.
It's great to have you. And I know that you and I have talked over the last several months about harm reduction and how important that is. So could you just tell us what is harm reduction? When we talk about harm reduction, what does that mean?
Sure. Harm reduction is really on the most basic level, strategies that people use to reduce harms associated with a certain behavior. Most typically, it's connected to people who are using drugs or engaging in risky behavior. But it's just any, we can take it in any behaviors. Seatbelts, for example, are a form of harm reduction. Any steps that you can take to reduce harm associated with a certain behavior.
Okay, so when we talk about drugs, what drugs specifically are you and I going to be talking about today, I guess would be the best way for me to word that.
Yep, so the program that I work at is a harm reduction syringe services or syringe exchange program. So we work primarily with folks that are active injection drug users. So most of our folks are injecting heroin or other opioids.
And as we have, over the last several years, it seems that things have gotten much more dangerous in terms of what is in the mix that people are injecting, unfortunately. So it seems that it's gone from opioids, a lot of which were prescribed initially, to then people would go on to heroin when the opioids that were prescribed kind of became unavailable. And now, is it fair to say that a lot, if not most of the heroin is mixed with fentanyl, which is very, very lethal?
Definitely, yeah, that's very accurate. Most, if not all, street heroin today is fentanyl, or a portion of it is fentanyl, which is a lot more dangerous, as opposed to, it's stronger than heroin, it acts faster in the body, and people don't have tolerance to it, and so it's much more dangerous. It puts people at much higher risk for overdose.
So one of the things we want to talk about in this today as well is about overdose and overdose prevention things. But first, let's get back to the syringe exchange program. So what is that? When someone is a participant of the services of Healthy Steps, what does that mean?
Sure. So we see people on a walk-in basis. We're open Monday through Friday, so we don't do appointments. Anybody can come in and utilize our services at any time. And we try to make our services as low threshold as possible, knowing that there's a lot of stigma and shame associated with drug use, especially injection drug use. Oftentimes, people may not access services if they have to give identifying information. So what we do is create a code for people. We ask random questions about first and third letters of your first and last name. And we create, and that code is individualized for each person so that it allows us to, for data purposes, track how many individual people we see without identifying those particular people. So we try to make it easy for people to come in and give the least amount of information for their comfort level. Ideally, it's called an exchange because what we want is for people to bring in syringes that have been used, and in return, we give them unused or new syringes. And we also provide people with all new supplies for injecting safely. I know that seems like a crazy thought for some people, but we operate under the understanding that people use drugs. People are going to continue to use drugs, and our goal is to get them to use drugs as safely as they possibly can without getting an abscess, without spreading HIV and Hep C, and just keeping themselves as healthy as possible while they're using. once we are connected with people, we actually provide a lot more services for folks once they come in the door. We do basic wound care. So if someone does have an abscess or an area that they're concerned about and they're not comfortable going to urgent care or the emergency department, or maybe they don't have health insurance or they don't have a primary or they're not comfortable with their primary, we can do basic wound care here for them. We also do a lot of referrals to connect people to services like food and housing and shelter and clothing and kind of whatever. We end up becoming kind of a catch-all safety net for people that may not have other providers.
So is it fair or accurate for me to say, so part of the goal is to develop a trust with each individual, and to do that, you need to be basically a non-judgment zone, so that when people come in, they know they're not going to be judged on the fact that they're using drugs, they're injecting, because the purpose of the program is, while we would perhaps like everyone to stop injecting, we understand they're not going to do that today. They're not going to do that immediately. So let's do what we can to help keep them, as you said, as well and as safe as possible until perhaps they are at a point where they want to stop. And for some people that may never happen, but at the very least, let's try to keep each of these people as healthy and safe and reduce the harm.
Yeah, definitely. It's definitely a lot about trust building and making people feel comfortable. And then they continue to open up more and more about struggles they're having or, things that they need. And so it's definitely a lot about trust building for sure.
Because I think the more that we as a society learn about the drug use, the more that that it's a medical situation. It's an illness as opposed to simply a matter of willpower. Right. At least that's my understanding.
Yeah, and one of the good things here is people can always come here, as opposed to some of the traditional treatment programs. They might have like a 3-strike rule, or if people use or identified as having used, they're penalized for that, and they're sometimes kicked out of the program, and there's maybe a 30-day waiting period when they can get back into the program. And that's really when people are most vulnerable, when they don't have that support. And if someone is continuing to use, to me, that shows they need more support, not to have their support taken away. So, I do enjoy that part of it, of letting people know they always can come back here, regardless of whether it's their first time here or their 50th time here, or whether we see them at detox or wherever else, they're always welcome back.
So I think that's a great point. And let's talk about, for a fact, for people who are saying, well, it sounds like all you guys are doing is enabling and encouraging and all that. Let's talk about what would happen if Help These Steps wasn't there. What would these people who right now are coming to exchange their used needles for new ones and are therefore not sharing and things like that, what would happen to these people, and what would happen to our communities?
There would be a lot more Hep C infections. There would be a lot more HIV infections. A lot of other sexually transmitted infections, because we also have condoms and do harm reduction related to sexual risk factors that people are engaging in. And just having the support here for people where we have snacks here for people that are homeless or unstably housed, that maybe they might go into a store and take something if they weren't able to come here and get a coffee or get a snack. They might break into a vehicle if they don't have money to buy syringes at the pharmacy. So it reduces the overall harms to the community on a much larger scale than just a one-to-one syringe exchange. And
many people that are using are people that, you wouldn't necessarily know that they're using. So if they were in fact not getting new needles and were sharing and came down with Hep C, they could very well infect someone that, you may know, I may know, and the same with the HIV and the STD. So it's really, as I understand it, in the interest of all of us to have harm reduction locations, because it ultimately keeps all of us safe, doesn't it?
Yeah, it's definitely a public health issue, and that's and Massachusetts Department of Public Health recognizes that, and that's why they support these programs.
Yeah. So you had mentioned about hepatitis C, and you guys are doing what I think is something really significant and I think very unique with helping people with hepatitis C. So first of all, what is hepatitis C, and then tell us what it is that Healthy Steps is doing.
Yeah, so Hep C, it's an inflammation of your liver. Basically, your liver is kind of like your body's filtering system. So it filters out the good and bad stuff that we put into our system. And so when you get hepatitis, that filter gets inflamed and it doesn't work properly. It's passed on through bloodborne avenues. And so a lot of times people who are sharing syringes are exposing themselves to Hep C because that's passing from one person to another. And so historically, people who are active injection drug users have trouble getting treatment for Hep C. Well, first off, a lot of people just assume that they have Hep C, and it's really, really common, and a lot of people don't seek treatment for it initially because they see it as not being symptomatic, not causing any problems for them. But as with any infection, the longer it kind of harbors, the worse off it gets. And so, like I was saying, people have trouble getting treatment because providers in the past have had this thought process of, I'm not going to treat someone's Hep C if they continue to use drugs, because they're just going to continue to expose themselves to Hep C. And so I'm going to wait until people can be abstinent from drugs for X amount of time. Usually that's 6 months to kind of quote unquote prove that people are almost worthy of treatment, which is really unfair. And it's one of the only infections that's treated like that. I've used the analogy prior as of chlamydia. If someone has chlamydia, it's easily treated with an antibiotic, but someone would never go to their provider with a positive chlamydia result and be told, I'm only going to treat this for you if you agree to stop having sex, because having sex is how you got chlamydia in the first place. And if you can't agree to stop having sex, then you're going to continue to expose yourself, and we're just not going to treat it. It just doesn't make sense. And Hep C is the same way. And so we started this really, really great program here. We're doing Hep C treatment for folks through telehealth. And actually, COVID has kind of been able to catapult that for us with everything, being virtual and people encouraging telehealth. So that worked in our favor. But we've connected with a great provider here at the health systems. Her name is Rachel Picone. And so folks come in here. We do the testing for Hep C here at the program. They are then connected with a Hep C care coordinator who helps them schedule their appointments, which are through telehealth. So they're again here at this location. They meet with Rachel, who figures out which medication is best for them for the particular genotype or strain of Hep C that they have. We have arrangements with the specialty pharmacy to have their medications sent right here to the office. So they also pick up their medications here. So basically everything is done right here in the office. Again, it's the trust that we've built with people. We're familiar faces to people. They know that we, are on their side and have their best interest. And it's been shown that when people have the ability to make those positive changes for their own healthcare, it has a domino effect, not only in their own lives, but throughout the community. As far as this program in particular, I see it really reducing the Hep C rates throughout Berkshire County. And the participants are really excited about it. People that have started to utilize the program, they speak really highly of it, and everybody's thrilled with it.
So to your point, that people who are coming into Healthy Steps and using the services, the new syringes and being tested, they are looking to begin to take care of their health and well-being, so that even under that old standard of not being able to be treated for Hep C until you're doing things to take care of yourself, that they're actually meeting that that criteria. Yeah. And then the beauty of the program, as you describe it, is that they already have this relationship with you and Healthy Steps, and they're already coming there anyway. So for them to be able to get their medication there and all of the other things, I mean, it's exciting that you're able to do this and to help people to at least rid themselves of Hep C, because you in the short amount of time you've done this, you've had some people who have successfully completed the program, and I don't know the terminology, but are hepatitis C free at this point, right?
Exactly. Yeah, we just started this program in June. June 1st we started, and we've had 5 people that have fully completed treatment, cleared their Hep C, and are undetectable. And we have another, I think, 9 or 10 people currently being treated, and then 12 to 14 people that are in the initial, I'm interested phase, or I've completed my blood work and I'm waiting for my appointment. So the numbers continue to grow.
Yeah. And we certainly have learned in this COVID-19 world how one person can infect so many. And so every time you are helping somebody with Hep C who also is not reusing the syringes and all that, I mean, it's really just such a good positive effect, I would think, on a big part of the Berkshire community. And I would think it costs a lot cheaper than if one or more of these individuals have to be hospitalized at some point. So I don't know.
Yeah, it's true.
So congratulations. It sounds like a win-win to me.
Yeah, thank you.
It's really a great program. So let's talk a little bit about overdose prevention and what you were able to do in that area, and also with distribution of Narcan. What is Narcan? Yep.
So Narcan is the pharmaceutical drug that reverses an opiate overdose. Yep. We constantly talk to people about overdose prevention and ways to reduce overdose, not only here in the office, but we also work with the community. Pre-COVID, we were doing a lot of community trainings on Narcan and how to recognize an overdose, how to respond to an overdose, how to get Narcan. We definitely have had to cut back a little bit and figure out some different ways to reach people with COVID. But we work with also people that are high risk in other areas, like the detox, for example, or some of the sober living facilities, the jail. Any period of abstinence for people puts them at higher risk for overdose. So we try to catch those people, even if it's, they were in jail for the weekend, a couple of days. People's tolerance drops really quickly. Okay. So we want to make sure people have that information about how to use Narcan, how to respond to an overdose. And anybody can come here at any time and get Narcan from us. Again, no appointments, just walk in. Any staff member can give people the training on how to use Narcan. It's very, very easy to use. It's just a nasal spray. And Massachusetts actually has a standing order for Narcan, which means anybody can use it, anybody can carry it. It requires no special license or anything. And I encourage, people to use it, because it's not just, you can be at the grocery store, at the gas station, and somebody may need Narcan. People use in public all the time. And so one of the great things about Narcan is it doesn't do any harm to someone who isn't having an opiate overdose. And so I always tell people, if you have any thought that it's possibly an overdose, to administer Narcan, because it can only help that person.
I mean, and we could be saving, someone's child,
Right.
Even someone's parent. Certainly, we see a lot of people who have children and are continuing to use, so that it's really, the idea that, I'll never see anybody that's having an overdose, or I don't know anyone that's using, because that's only those people or those other people or whatever. I mean, unfortunately, it's all of us and that are affected by all of these things. So yeah, from what I knew a year ago to what I know now, I've learned a lot, and I've become a believer in harm reduction and in the fact that, we all are our brother's keeper, and we want to be able to take care of each other, and having Narcan and and not judging. That's the other big thing, just because that one of the things, as we talk about addiction, that it's an illness. It's a physical consequences on someone when they begin to use, that it takes more than one time, more than one try for people who desperately want to stop and are getting the treatment wherever they may go. It takes usually more than one time. Is that fair to say?
Yeah, I'd say that's really, really accurate. Yeah. And it's not one pathway or one avenue that's, a surefire way that here's what you need to do, and it's going to be the solution of your life. What works for me may not work for the next person. And what worked for me the first time may not work for the next person the 12th time or the 13th time. But, going back to Narcan, if people aren't alive to continue trying, then they're never going to be successful. And so the more chances that people are given, the more avenues that are available for people, and the more resources we can connect people with, the better off, again, we will be as a society.
Yeah, right. So somebody who's been working really hard and trying to stop, if they should have a lapse or a slip or whatever you want to call it, and they do use, they're at particularly high risk for an overdose based on what you're saying. Is that right? Yeah,
especially going back to the shame and the stigma. If they've, not been using for a period of time and they've had a relapse, they may not want to tell anybody about it because of that shame judgment. And so they may use alone so that they don't have to tell people. And that definitely puts folks at high risk for overdose. So whatever the situation is, just never use alone.
Yeah. And that's the thing too, that, that when you say with healthy steps, there's no 3 strikes and you're out or whatever, you're never out. So you want people to come and to get the clean supplies, and also so you can share this information with them that, be careful because you haven't used in a while, your tolerance is low, and don't use alone. There's even a program where people can call someone and if they're going to use alone, and then they have that number. Are you guys doing that?
There is flyers around the office for it. Yeah.
Okay.
Yep. People can take with them. Yeah.
So how does that program work? Can you talk about that a little bit?
I'm not fully familiar with it. I know there's volunteers on the other end of the phone that will either call you back or text you back if you don't reply within a certain time frame after you've used. Okay. So basically you call someone and say, I'm by myself, here's where I am, and they'll call or text you back. And if there's no response, then they call for help for you.
Yeah. And then once they know you're okay, they don't keep the number, they don't report you or anything.
No.
It's really, again, it's based on that trust and wanting to just reduce the harm of using alone. So if somebody is listening to this show and says, I'd like to learn more about overdose and Narcan, I'd like to see if I could get some Narcan, what should they do? What could they do?
Yeah, they can stop into the office at any time, which is at 510 North Street in Pittsfield. Okay. Like I said, we're here Monday through Friday, 8 to 4. Anybody can call the office, 447-2654. People can also get Narcan at other locations in the county. Mm-hmm. Tapestry offers Narcan for people. And also most of the local pharmacies, you should be able to access Narcan at the pharmacies. Okay. The good thing about some of the community programs like Healthy Steps and Tapestry is we don't use insurance. So again, we don't take identifying information for Narcan that we distribute to people. We create that same code for people. So sometimes, back to shame and stigma, people may not want to use their insurance or whatever, whatever the case may be. Maybe they, pick up their family medications at the pharmacy and they just don't want the pharmacist to know that they're getting Narcan for whatever the reason. We again try to reduce those barriers and just get Narcan into the hands of people that it will help.
So what are the charges for your services?
Zero.
Zero.
Zero across the board for any of our services.
So someone can come in and ask for Narcan. You will give them a brief training, and then they can leave with Narcan, and that will cost them nothing.
Absolutely.
Okay. And the same with the testing for the STDs, Hep C, HIV. Now, if someone is not using and injecting, could they still come in and get tested in case they think maybe they have contracted one of those diseases from someone else, someone who's using or maybe not even using? Can they come in?
Yep. We do testing for anyone. So you don't have to identify as an injection drug user. We do testing for HIV, Hep C, syphilis, gonorrhea, and chlamydia for anyone over the age of 13. Again, no appointments, just walk in at any time and we can do that.
Great.
And the other thing is we're also a community syringe disposal site. So we have folks who are, for example, diabetic and know where to dispose of their syringes. They can drop those off here at any time as well.
Okay. Sarah, give us a number for Healthy Steps. We're going to have one on the screen. It's been showing, but just if you have one in front of you.
The phone number?
Yes.
Is 413-447-2654.
Great. We've got a minute left. Any final thoughts that you want to leave us with?
Oh, I really just thank the community and thank the Berkshires for supporting the harm reduction work that we've done thus far and continuing to expand harm reduction programs and recognizing the need for them because they are so valuable and they will be a benefit to the community.
It doesn't enable, it's just keeping people alive and keeping them as healthy as possible and out of harm's way until perhaps
and connected.
And connected.
Yeah.
Wonderful.
Especially in today's world, human connection is needed. And so we provide that for people as well.
Well, I think you guys do a great job. Keep up the good work and stay well.
Likewise. Thank you.
And we hope you enjoyed this show. I know this is information that can help you or someone you know. Healthy Steps and Harm Reduction. Thanks for joining us today.